Oke, jadi untuk webinar, please saling menghormati satu sama lain, sehingga semua orang di sini akan di-mute ya, speakernya, dan video akan dimatikan. Dan percakapan antar audiens itu juga disable, tapi kami mempersilahkan kalau kalian ada pertanyaan, silahkan kalian bisa ketik di Zoom Q&A, kolom Q&A. Kalau Anda lihat mungkin di HP atau di iPad ada tulisan Q&A. Nah, kalau kalian mau bertanya apa aja, ketik di situ, anytime. Kalau yang kolom chat itu bukan untuk question and answer ya, itu hanya untuk kalau kalian mau tanya sesuatu ke panitia. Jadi kalau kalian mau bertanya untuk dokter, tolong ketik di Q&A. Dan webinar ini direkam untuk keperluan arsip. Oke. Dan webinar hari ini diselenggarakan oleh Friendlink dan didukung oleh Thomson Medical Center Singapore dan 9 Organizer. Izinkan saya untuk memperkenalkan siapakah itu Friendlink. Kami adalah warga negara Indonesia yang sudah tinggal di Singapura selama lebih dari 10 tahun. Dengan keinginan dan harapan untuk membantu teman-teman di Indonesia untuk mendapatkan perawatan dari dokter yang tepat dan komunikatif tapi tidak komersil, kami memperluas jaringan kami dengan hampir semua rumah sakit private di Singapura, KL, dan Penang. Kami juga bermitra dengan lebih dari 30 rumah sakit dan 3.000 lebih dokter-dokter. Mulai dari dokter anak, dokter kandungan, dokter lansia, dokter kanker, hingga dokter bedah dan spesialis otak. Kami juga bermitra dengan ahli gizi, dokter anti-aging, dokter kulit, dan estetika di Singapura. Selama 3 tahun terakhir, kami bermitra dengan dokter-dokter dan institusi medis di Singapura. Kami berkunjung ke kota-kota di Indonesia untuk berbagi informasi terkini di bidang kesehatan dengan rekan praktisi medis seperti Universitas Kedokteran, rumah sakit, dan dokter-dokter di Indonesia. Kami juga mengadakan seminar-seminar di Bandung, Jakarta, dan Surabaya untuk memberikan info terbaru mengenai kesehatan kepada teman-teman kami di Indonesia. Friendlink juga bermitra dengan lebih dari 300 apartemen servis di Singapura yang bisa mengakomodir kebutuhan pasien dan keluarga pasien untuk masa-masa treatment dan pemulihan. Karena apartemen servis yang mempunyai fasilitas seperti ruang makan, kulkas, dapur, mesin cuci, akan membuat pasien dan keluarga pasien nyaman seperti di rumah sendiri. Di tahun 2019, kami bermitra dengan Thomson Medical Center untuk membawakan seminar bertopik anti-aging dan menopause kepada perempuan-perempuan gelis di Bandung. Acara tersebut didukung oleh Firm Point Pilates by Sansan, Papelaria Batik, dan Ladang 5 yang hari ini menjadi sponsor door prize kita malam hari ini. Dan selama tahun 2020, dengan pandemi COVID yang menimpa seluruh dunia, kami tetap berharap untuk bisa mengedukasi teman-teman di Indonesia, memberi informasi yang penting mengenai kesehatan dengan mengadakan webinar atau seminar secara online. Dan di webinar kita kali ini dengan tema Self-Awareness is the Best Prevention, kita akan mendapatkan info penting tentang bagaimana cara pencegahan dan deteksi dini kanker serviks atau mulut rahim dan kanker payudara. Webinar malam ini didukung oleh mitra kami Thomson Medical Center dan Thomson Breast Center. Silakan, Thomson Medical Center.
Thomson Medical Group is a leading private healthcare provider headquartered in Singapore. It owns and operates Thomson Medical Center, a hospital with close to 40 years of medical expertise in obstetrics, gynecology, and pediatrics. Thomson Medical has transformed from an operator of healthcare facilities into an integrated healthcare system that provides care and support for the whole family, focusing on preventive care and health promotion. Thompson Medical Center was the first private hospital focusing on obstetrics, gynecology, and pediatrics, where patients experienced personalized care in a home-like ambiance. Thompson Medical Group focuses on 3 business areas: hospital services, specialist clinics, and consumer products and services. With close to 40 years of serving women and children, more than 500 hospital staff serves almost 24,000 inpatients each year. About 30 doctors have their medical clinics within the hospital and use the hospital facilities for their patients. In addition, close to 1,000 doctors are accredited to the hospital and have admitting rights to TMC. The hospital facilities are constantly being upgraded to meet patient demands and to improve their experience. Equipped with 190 licensed beds, the hospital boasts a variety of room options to meet the accommodation needs of all our patients. Thompson Medical has helped families celebrate life by embracing the birth of more than 8,000 babies every year. We are also proud to be the only private hospital in Singapore to offer water births to mothers looking for an alternative way to birth. Thompson Medical has steadily expanded its operations, evolving from an obstetrics and gynecology specialist hospital into a healthcare group with an expansive network of specialists and specialized centers across the island. To better meet the needs of the entire family, Thompson Medical has developed a series of consumer products and services. Thompson Medical has clinched numerous awards throughout the years. The awards are testament to the hard work, commitment, and passion of all our staff. Thompson Medical's vision is to be the Pan-Asian integrated healthcare system of choice by expanding our multidisciplinary healthcare not just in Singapore, but all across Asia.
TMC Life Sciences Berhad, located in the heart of Kota Damansara, with close proximity to established townships and neighbourhoods within Klang Valley. TMC Life Sciences Berhad is the premier provider of high-quality, value-based and outstanding medical care across Southeast Asia. Established in 1994, TMC Life Sciences Berhad aims to deliver exceptional medical services and compassionate care at world-class standards. Whether it is 24 hours emergency care services, intricate surgical procedures in the state-of-the-art operation theatres, or the fully equipped multidisciplinary wards, we remain committed to provide quality and value-based care for both our local and international patients. Poised for exponential growth in the near future, TMC Life Sciences is expected to add another 900 beds to its pipeline. Its flagship hospital, Thompson Hospital Kota Damansara, is being developed into a fully integrated health complex with an additional 400 beds, 10 operating theatres, 110 outpatient clinics and 1,100 car park bays. Featuring even more centres of excellence, a new health and wellness centre and a seamless integration with the Kota Damansara MRT station, the new Thompson Hospital Kota Damansara is expected to be one of the largest private healthcare institutions in the region. TMC Life Sciences continues its growth trajectory by establishing its footprint in the southern region of Malaysia. The fully integrated Thomson Iskandar Medical Hub in Johor Bahru will comprise of a 400-suite medical tower, the 500-bed Iskandaria Hospital and an advanced nursing and allied health training institute, and poised to turn Johor Bahru into a top healthcare hub.
Celebrating life, caring for generations and beyond.
Thompson Medical Center adalah rumah sakit swasta di Singapura yang memiliki kredibilitas lebih dari 40 tahun dan berfokus pada ginekologi, kebidanan, dan perawatan kesehatan anak. Dengan 300 dokter spesialis dan 35 pusat spesialis untuk kesehatan wanita yang meliputi payudara, kanker khusus wanita, bedah umum, kolorektal, gastroenterologi, dan urologi, Thompson Medical merawat sekitar 23.000 kasus rawat inap per tahun dan lebih dari 240.000 rawat jalan per tahun. Thompson Medical Center juga menawarkan berbagai layanan medis holistik, termasuk perawatan sebelum kelahiran, perawatan sesudah kelahiran, perawatan kesuburan, pengobatan tradisional Chinese medication, estetika, dan pemeriksaan kesehatan umum. Thomson Breast Center adalah bagian dari Thomson Medical Center. Ya, Thomson Breast Center adalah pusat payudara yang didedikasikan untuk diagnosa dan pengobatan semua masalah yang berhubungan dengan payudara, mulai dari penanganan masalah menyusui, biopsi, pengangkatan benjolan payudara, sampai operasi kanker payudara. Berlokasi di Thomson Medical Center, Thomson Breast Center berfungsi optimal karena bekerja sama dengan jaringan dokter-dokter spesialis di Thomson Medical Center, laboratorium, dan pusat scan seperti mamogram dan ultrasound. Yang menjadi speaker kita malam hari ini adalah Dr. Tan Yaswam. Dr. Tan Yaswam adalah ahli bedah umum dengan spesialisasi di bidang bedah payudara dengan pengalaman merawat pasien lebih dari 15 tahun. Sebelum praktek pribadi, Dr. Tan telah merawat pasien di Singapore General Hospital atau SGH, di National University Hospital atau NUH, dan Rumah Sakit Tan Tock Seng. Dr. Tan sangat berdedikasi untuk memberikan diagnosa yang cepat dan akurat bagi pasiennya, dan telah mengembangkan jaringan yang kuat dalam perawatan multidisiplin untuk memberikan sistem perawatan payudara yang terbaik. Dr. Tan juga aktif melayani komunitas medis dengan Dewan Asosiasi Medis Singapura atau SMA sejak 2008 dan merupakan presiden wanita pertama di dewan tersebut. Sekarang saya persilahkan waktu dan tempat untuk Dr. Tan Yaswam. Mari kita sambut Dr. Tan Yaswam. Welcome, Dr. Tan.
Thank you very much for the warm introduction. So it's my pleasure today to speak to our audience here about how to detect breast cancer and to emphasize the importance of early detection, which helps in early treatment. So let's go through some common facts at first. Breast cancer is the most common cancer affecting women worldwide. And did you know that breast cancer can be prevented? Using mammograms, we can be able to detect early change, such as atypia, and after removal of atypia, we can prevent breast cancer. The other advantage is we can detect stage 0 cancer, also known as DCIS. Most lumps that women detect themselves may not be cancerous. And importantly, there is effective treatment for breast cancer. So in my practice, I find that many women have inadequate knowledge, leading to a lot of unnecessary fear. So maybe they've heard their friends or they read somewhere on the internet. It's good to attend a medical talk to clarify some of these doubts. Some women believe that a pain in the breast is equal to a cancer, or that all lumps is equal to cancer. Another common one is chemotherapy is very harmful and that cancer patients suffer a lot. I hope to be able to reassure our audience here that all these are not that true, so that there's don't have any unnecessary stress, and that it doesn't lead you to delay or reject recommended treatments. So how do we prevent breast cancer? Some things that we cannot control would be things like our family genetics. But the fact is genetic cancer is very rare. It will be less than 10% of all affected women. Age is one thing that we cannot control. The older we are, the higher the chance of breast cancer. And how about the age that we start having our period, the age of menopause? These are things that, these are inborn things. So how about other factors that we can control to protect ourselves? First is the amount of hormone exposure. By having more children, by doing longer breastfeeding, by taking less amount of oral contraceptive pills, these are protective. People who smoke should stop smoking. People who drink alcohol should also reduce the amount. All these are protective as well. Ladies who are very obese should try to exercise, change the food to be able to lose some body fat. It's always good to exercise. That will make us fitter and protect against other cardiovascular disease. Now, most importantly, all women should be confident in doing a monthly breast self-check and start doing a yearly mammograms from age 40 onwards. So what is a mammogram? A mammogram is an X-ray of the breast. It's good to start when we turn 40, and for women where the mammogram report shows dense breasts, we should add on an ultrasound. These will help to detect any early change to prevent cancer, and even if cancer is detected, it's in a very early stage called stage 0 or DCIS. A mammogram is done in the radiology department. There will be a technician to help to position the breast between two metal or plastic plates. There is some firm pressure applied and the x-ray is taken. There will be quite standard two views, top and bottom views of the right and left breast, and what I call a sideways view of the right and left breast to help us look for any abnormal calcium spots. So a lot of my patients always argue and don't want to do the mammogram because they always say, I've heard it's very painful. Well, I myself have gone for mammogram before. So it is quite uncomfortable, but it is not painful. There's no cutting, there's no sharp burning pain. It's just a pressure. Then some people have heard the radiation is dangerous or harmful. The fact is the dose is very low. It's maybe equivalent, the same like exposing to sun for about 2 months. So the benefit of detecting early cancer outweigh the risk. Some will argue, I've done it before, why must I go again? Now, our recommendation is good to do a yearly mammogram from 40 to 50, and after 50 years old, every 2 years. Because if every year you go, the minute there's a small abnormality detected, the earlier you can get treatment. And some women, opposite, they are very scared there's something abnormal. That's why they don't want to do. Now, I don't agree. Not all abnormalities are cancer. And remember, if it's early cancer and detected, it is very treatable. So some will argue, how about doing the screening ultrasound only? Now, mammograms, ultrasound look for different things. On the mammogram, if a cancer is very big, like a 3-4 centimeter lump, can be felt, can be seen on ultrasound. If the cancer is 1 centimeter, maybe by feel we cannot feel it, a mammogram can see, ultrasound can also see. Now we move back to an even earlier stage when there's only calcium spots. So DCIS or even earlier called atypia. Now these calcium spots will not be seen on the ultrasound but can be seen on the mammogram. So a lot of lumps most women would feel a lot of lumps in themselves, and that is what brings them to see a doctor. If you ever feel one, remember to stay calm and just see a doctor. Don't diagnose yourself with advanced cancer. So what can a breast lump be? In some women, it's just a normal lumpiness. This is the background hormonal change. The medical term is fibrocystic change or sclerosing adenitis. This whole list is all the other possibilities that a lump can be. I will explain more in the later slides. So first, revision about what the breast is. If we look at the sideways picture of the breast, the first layer is skin, and then after that, we have some body fat. The purple colored dots represent breast tissue. Then there's blood vessels. Inside you have muscle and you have the bone. So any of these layers can form a lump. Now, earlier we talked about the hormonal change. So normal period, the woman will have this kind of breast tissue. When the menses is coming, a lot of times it gets a bit fuller, a bit more sensitive, a bit harder. These are small little water cyst changes. And biopsy is what will tell us what the changes are. This is a normal fluctuation that almost all women will have. Now, in the cyst, all women will have some kind of cyst at some point in our lives. And if I scan 100 women, 40% of them will have cysts at that point in time. So depending on the color, the shape, whether there's any signs of infection or solid part, the breast doctor will recommend any need for biopsy. But most times it is a normal hormone change. Then fibroadenomas, this is a common condition in the young people. If you heard of fibroid in the womb area, this is like a fibroid in the breast area. So this kind of lumps can grow very fast during puberty or pregnancy because of increased hormone. Now, some patients will ask, must I go for operation? Most times, once we've checked that the ultrasound or biopsy is normal, there's no need to remove it. But for some women, it keeps growing every year, getting larger, or the lady can feel the lump, they get very stressed, then sure, minor operation to remove the lump will solve the problem. Now, for fibroadenoma, there's a small group that we need to monitor more closely because it's called a phyllodes tumor. It can grow very fast, something like that. So it's a good habit to still go back to see your doctor once a year, once every 2 years to make sure that the lump is not growing very fast. even after the surgery and testing, we don't call it a cancer. It's a different kind of condition. In some women, their kind of lumps is really just body fat, so they are harmless. It can be after a bit of an injury. Some people say the grandchild kicked the breast area, then the fat die inside, called fat necrosis. Some people, the fat lump just grows very big and is very soft. For some patients, there's a lot of blood flow. That's why the lump is more painful and more sensitive. That's why they go for surgery. Then, of course, this is the one that everybody is more concerned about, breast cancer, also called a carcinoma. So this kind, on the mammogram, on the ultrasound, we will see very obvious pattern, irregular thing, very hard, solid nodule. And on the operation, for patient mastectomy done, the lab doctor will cut and confirm the size of the cancer. Now, pain. So pain is not a sign of cancer when it's alone by itself. And the breast cancer, surprisingly, most times don't cause any pain. Painful breasts in most of us are due to hormonal changes during our periods or due to muscle straining. So it's a very, very common problem. And when patients see me for a breast pain, in some patients, we happen to find a cancer. So I think when the patient then tells a friend, they always start the story, oh, the other day I got breast pain, I saw the doctor and I found cancer. That's why so many people are confused that pain leads to the cancer, but actually they are not related. So if let's say you have a bit of breast pain just once in a while, good to see a doctor to do a physical examination to confirm there's nothing abnormal. Depending on your age or any other findings, the doctor may recommend a scan, ultrasound or mammogram if you're above 40. Once confirmed normal, some of the treatment we prescribe are evening primrose oil as a herbal supplement to make sure that the pain is not so sensitive. Then for those ladies who are very disturbed by the pain, cannot sleep, cannot carry things, just take a bit of painkiller medicine. Then otherwise, less coffee, less tea, less caffeine so that the body is not so sensitive and stressed. Finally, a very simple thing like wearing the correct bra, because all of us as we have children, we grow older, the body shape and size will change. And we might be surprised to find that the bra support is important to make sure that we don't have pain in the breast area. The next photo shows a lady who found a lump but did not see a doctor. It's a locally advanced breast cancer. So if you are not familiar with such picture, it might be good to look away for a short while, yeah? So this patient is a real patient of mine. So she first found a lump a few years ago, and because she thought it's not painful, she thought not serious and delayed seeing a doctor. Over the years, it slowly become bigger, started to grow through the skin. Yeah, so this is a very large, locally advanced breast cancer. The center part, the cancer had died off. And at the surrounding, there's a bit of blood. Even at such an advanced stage, surprisingly, there's no pain, just some discomfort. So what can you do today to protect yourself? First is to learn how to do your own breast self-examination. It'll be good to know your family history because that helps the doctor to decide is your family at risk of a genetic cancer or not. If you're age 40 and above, whether you feel well or not well, please go for a mammogram and consider adding on the extra ultrasound. If you find your breast lump, make an appointment to speak to a doctor. So, of course, in the private practice, you can call the specialist directly or ask your family doctor to recommend someone who can look after you. So what happens when the patient comes to see the breast specialist? First, we will do a very long history to investigate and to assess your risk of having a cancer. Next, definitely, there'll be a very thorough examination to confirm is there any breast lump and look for any other signs such as a nipple discharge. After that, I always arrange for any necessary imaging, mammogram, especially at age above 40, and ultrasound. Then depending on what they show, then we recommend a biopsy. And ultrasound is the same technology as scanning the baby. It is no radiation. It is a very safe kind of scan. So it is useful in the clinic. Sometimes when I feel a lump, I put the ultrasound on immediately and we see the kind of the shape and even check the armpit area for any enlarged lymph nodes. Then when necessary, the biopsy can be done. A biopsy is a needle test to sample the lump to confirm what it is. A lot of patients are worried, is it painful, is it dangerous? I actually do it in the clinic. It's given a local anesthetic to numb the skin. Internally, the breast doesn't feel pain so much, just some pressure. So after that, a very small cut is made here and the larger needle is pushed in to try to sample bits and pieces. And then this is sent to the lab. This one is what I use in the clinic, a very simple bedside ultrasound, and this is the device I use to do the biopsy. During the biopsy, patients who want to see it like a documentary, they will see the needle passing through the lump. Now, if a cancer is diagnosed already, then what happens next? A lot of patients will jump straight to ask what's the stage and what's the treatment. We will actually need to arrange quite a few more things before we can advise. There will be whole body scans, either the CT scan or bone scan, or more commonly, more accurately, the PET CT scan. Based on the biopsy result, we ask for additional tests called the ER, PR, and HER2 receptors. This will give us more information as to what kind of breast cancer it is and what kind of additional treatment is needed. Then what I do with my patients is to discuss all the treatment options available. A lot of the developments have happened in the recent years. Some patients are suitable for surgery first, followed by chemotherapy. Some patients, though, should have chemotherapy first, then surgery. Then in some patients, they might need to go for radiation treatment, X-ray treatment. And for patients with more advanced cancer, we need to discuss palliative care. So in my practice, I always coordinate with all the other necessary specialists and let the patient have more information before we decide. So myself, I'm a surgeon. I work closely with the chemo doctor, the oncologist, and the radiation doctor, radiation oncologist. So generally, I tell my patients, no need to rush, but also don't delay. It can take a few days to maybe at the most 2-3 weeks to decide what is best for you. But don't wait until 2 or 3 months later before deciding for treatment. So staging scans, some of patients call it the spaceship scan. They lie down in the tunnel, sometimes with a bit of injection, and they go inside. It will give us a very detailed 3D scan of the internal part of the body. So like these are examples of a patient with very large right breast cancer, where the cancer is grown into the muscle. This kind is we cannot operate. We need to cut too much. So such patients need chemotherapy first to make the cancer smaller. In this patient, there's a small lump seen in the lung. We actually need to check, is this a different lung cancer or is this a breast cancer that spread to the lung? In this patient, unfortunately, the cancer has spread to a few parts of the liver. So this kind of patient is called stage 4 patient. We will start them on palliative chemotherapy first. Now, histology is what they put in the microscope. So this again is sent to the lab, and the lab doctor will also do their job to decide what kind of breast cancer it is. And then the chemo doctor and I will decide which is the treatment pathway to recommend. Now, under me, I will decide or advise the kind of surgery necessary. So I like to discuss the treatment option to think about what needs to be done for the breast and what needs to be done in the armpit area, the axilla. So traditionally, most patients will need to have a whole breast removal called the mastectomy. All patients with mastectomy done can always consider a reconstruction. In some patients where the cancer is smaller, they can do something called the white excision, also known as the lumpectomy. In the armpit area, we will do something called sentinel lymph node biopsy to check if there's any spread. If there's no spread, then that's very good. But if there's a spread, then during the same surgery, I go on to do axillary clearance, where all visible lymph nodes are taken for testing. So there's no right or wrong, there's no best treatment option. A lot depends on the actual size of the cancer, where the cancer is, which part of the breast area, and how many cancers there are. In some younger women, we actually do a blood test to check for genetic mutation. And if there is, we will discuss, should we even remove the normal side as well, known as a preventive surgery? Then otherwise, a lot depends on the person's personal health, lifestyle consideration. Example, some people are very young, not married yet. They will like to have reconstruction so that the body to them feels and looks normal. Then in some women, where they're in a stable relationship, they've already got some grown-up children, they don't mind having the mastectomy, where it leaves a flat chest. So these are some examples of what the different types of surgery is. In the top left, we see the traditional mastectomy, where the breast and nipple is removed, leaving only skin over the muscle area. The second one shows the lumpectomy, where there's a scar to remove the cancer and a little bit around it, and a separate cut in the armpit area to check the lymph node. you notice that this breast, of course, is a little bit smaller now, yeah, and the shape looks a little bit different. For this next patient, she had looks like she has bilateral this nipple sparing mastectomy. So it's done through the round cut around the nipple. Internally, the breast has been removed, and then after that, a plastic surgeon will remove some muscle and fat from the tummy area and move it inside so that there's a natural shape for the breast. After the surgery, most patients go for chemotherapy. So chemotherapy has also improved a lot in the recent years. Most of it is done in the outpatient setting by the oncologist with very specialized nurses. Depending on how patients are, some of them do pretty well during the chemo, still able to do a very light job or maintain an active lifestyle. Some women get a bit more tired and more weak during the chemotherapy. Targeted treatment is given as an injection. This is only for patients with something called the HER2 positive cancer. Radiation therapy, more commonly for patients with a lumpectomy done, is usually done as an outpatient as well. X-ray to target only the breast area. Nowadays, the machine are very good, can go sideways so that the lump and the heart are not injured. The side effect is that the skin looks a bit like sunburnt temporarily. After another few weeks, it will recover. And finally, for the patients with ER, PR positive cancers, they will need to be on some kind of anti-hormone medicine, usually for about 5 years. So I think this is one of my final slide. Remember, don't be afraid of breast cancer. Don't be afraid of going for check. Early detection means early treatment and leads to better survival. This is one of the most commonly quoted survival curve where we talk about different stage of cancer. At stage 0 and our treatment done, at 5 years, 10 years, more than 95% of patients are still alive and well with no problems. Stage 1 is also excellent prognosis. At stage 2, there may be about 70-something%. And of course, the more advanced stage, the number of patients who are still alive after 10 years will be a bit less. So remember, make sure you go for your health screening, do your own breast self-examination. So in case you do develop cancer, we find it at a very early stage. With that, I thank you for your attention.
Terima kasih. Thank you, Dr. Tan. Kalau barusan kita sudah mendapatkan informasi yang sangat penting dari Dr. Tan mengenai payudara, pencegahan dan deteksi dini, sekarang kita akan mendengarkan info yang tidak kalah pentingnya dengan speaker kedua kita malam ini, yaitu Dr. Freda Koo. Dr. Freda Koo sebelum mendirikan kliniknya sendiri berpraktek di Departemen Obstetri atau Kebidanan dan Ginekologi di Rumah Sakit KK Singapura. Beliau sangat ahli dalam menangani berbagai kondisi kebidanan dan ginekologi, menangani banyak persalinan dan operasi dengan berbagai macam kasus dan kondisi kehamilan, seperti fibroid atau kista ovarium. Dr. Koo memiliki akreditasi untuk bedah invasif minimal yang advance, juga dikenal sebagai keyhole surgery. Beliau juga merupakan ahli kolposkopi yang terakreditasi di The Society for Colposcopy and Cervical Pathology of Singapore. Saat bekerja di Rumah Sakit KK, beliau menjalankan klinik kolposkopi yang merawat kelainan pada pap smear pasien-pasien. Dr. Koo sangat yakin akan pentingnya pencegahan kanker serviks melalui screening dan pengobatan lesi preinvasif. So now I welcome Dr. Freda. Please, Dr. Freda.
Hi, good evening, everybody. Thank you for coming to this webinar, and I want to thank the organizers for giving me this chance to speak to everyone. Today, we are going to talk about a very important topic called Inside Her, cervical cancer, the silent killer. Now, firstly, what is cervical cancer? Where is the cervix? If you see this picture over here, there's a picture of the female reproductive organs. We can see that this is the uterus. On both sides of the uterus, we have the ovaries and the fallopian tubes, and the vagina is here. And the area that I have circled is the cervix. And this is the area that we are concerned about today. And this is the area that gives rise to cervical cancer. Let's firstly go through some myths about cervical cancer. I'm sure all of us would have heard, from friends, relatives, little bit about cervical cancer. You might have formed your own opinions. You might have some information about it. You're not sure whether it is accurate. So number one, some people say, if I have pain in my pelvis, maybe I have cervical cancer. Is that true? The truth is, early cervical cancer actually has no symptoms. Usually by the time it has progressed to late stage cervical cancer to produce symptoms, it would have been many times too late. So remember, early cervical cancer actually has no symptoms. Next, I'm young and healthy, so I have no risk of getting cervical cancer. Why should I even be worried? Is that true? Well, the truth is, age is actually not a risk factor for getting cervical cancer. So what is a risk factor? Risk factors for cervical cancer would be things like smoking, early age of sexual debut, which means you have had sexual intercourse from a young age, history of other sexually transmitted diseases, or history of multiple sexual partners. Another myth about cervical cancer: my grandma had cervical cancer, so I am at risk too. Is that true? Is it hereditary? Can it be passed down the family? Well, the answer is cervical cancer is not hereditary. So if you had an auntie or a relative who had cervical cancer, rest assured your risk for cervical cancer is actually not increased compared to that of the population. Okay. So now the question is, what causes cervical cancer? You see this very beautiful picture over here. These are balls. They're not of Christmas decorations, but these are actually the human papillomavirus, or what we call the HPV for short. It is actually a virus, something like the coronavirus, except this virus likes to live in the female reproductive organs. It likes to live in the vagina and the cervix. And this is the virus that causes cervical cancer. Okay, it is usually spread by sexual contact. There are many hundred over types of this virus, and not every single type is dangerous. Not every single type is high risk. Out of these 100 over types, there are some high-risk types. Most notably, the highest risk would be types 16 and 18, and a list of a few other high-risk types. And actually, there are many, many other low-risk types. Out of the low-risk types, some of them actually cause cervical warts instead of cervical cancer. Okay, now let's look at this chart. It's quite a busy chart, but it actually gives us a lot of information. If you can join me, if you follow me, this is a picture of the cervix, the skin of the cervix. This is a normal cervix. And then when the HPV virus decides to infect the skin of the cervix, most of the time, if our immune system is strong and good, it can clear it, just like how our body clears a flu virus. However, if our immune system is not strong enough and it is unable to clear the HPV virus out of the system, the HPV virus can remain in our system. And over a period of time of months, it can cause the cells to change in appearance. Okay, and if this is not picked up and the body yet again cannot clear it, over a period of months again, it can turn into CIN1, which is early stage precancer, the first stage of precancer, and then subsequently to CIN2, CIN3, and eventually to cancer. Okay, this is where regular pap smear screening comes in. When we do regular pap smear screening, we are hoping to catch the disease in this early stage, in this early CIN1 2 and 3 stage, so that we can very effectively treat it and cure it before it progresses into full-fledged cancer. Okay, because if we catch it at this early stage, it is very easily treatable. The treatment is very easy and it will not cause any long-term consequences. Yeah. Okay. Now, next, we talk about why do we want to screen for cervical cancer. Now, when we talk about screening tests, you might say there are so many diseases in this world. Why don't I just screen myself from head to toe? Screen myself for everything, right? Why do we purposely want to screen for cervical cancer? If you can follow me, not everything can be screened and not everything is beneficial to be screened, okay? But out of so many diseases, cervical cancer is a good cancer to be screened, okay? Firstly, there must be significant burden of the disease in the population, which means the disease must be fairly common in the population. If it is a very rare disease, there's no point in screening it because we will not be able to pick it up. Next, the target condition is morbid, which means if you screen for the chance of you dropping a tooth, you know, that is not consequential. So there's no point of screening it. But if you screen for something that can cause certain morbidity, it can even cause very severe consequences like death, then it is worthwhile screening for it. Next, the cervical cancer actually has a very detectable and long preclinical stage of disease. So if you remember the chart just now, there is a very, very long pre-cancer stage, okay, which lasts from between months to years. And this is the time that we can very effectively pick it up. Okay. Next, the screening test is accurate. The screening test in the form of a pap smear is very accurate. Next, the screening test is low risk, which means it doesn't cause you any harm. For example, if you are going to screen for lung cancer, right? Every year you have to stick a needle into your chest and aspirate cells from your lungs. And in the process, you might risk injuring your heart, your blood vessels. Now, that is not a good screening test because it can cause so much injury. But the pap smear test is actually very low risk. It does not cause any injury at all. Next, it is acceptable to patients. So by now, many patients would know and be very acceptable of pap smear screening. Next, there is an effective treatment available for the disease, which means if we pick it up early, we can very easily treat it and cure it, and you will be cured of cervical cancer for the rest of your life. Next, I'm sure many countries, including Singapore and I'm sure Indonesia as well, have a policy of effective screening program for the disease. Okay, so how do we screen for cervical cancer? The picture on top shows the tools that we need to use. It includes a brush, and this picture shows how we do it. So essentially, we use a speculum. We place the speculum into the vagina in order to visualize the cervix, and we use a brush, on the other hand, to pick up cells from the cervix. And then we put the cells in this transport medium and send it to the lab for testing. Okay, so that is the basic traditional pap smear. In the last few years, many clinics and governments have actually started introducing this idea of a HPV testing. It is actually the same test, but we send it for additional test. So actually, if you remember the diagram again just now, if you remember the diagram again just now, when we do pap smear testing, we're actually testing over here, okay? But if we test for HPV, we are picking up the disease over here. So hopefully we pick it up earlier and we will be able to treat it earlier, and we will be able to prevent ourselves from getting onto cervical cancer earlier. Okay, sorry, excuse me. Okay, now the question is, what happens if I get HPV? Yeah, so this is what I was talking about. So the question next is, when should I do the test? For all women who have ever been sexually active, if you are between 25 and 29 years old, you should do a pap smear at least every 3 yearly, at least. If you are more than 30 years old and above, then you should be doing a pap smear plus a HPV testing at least every 5 yearly. These guidelines are the minimum. Of course, if you are able to afford the time and resource to do it more frequently every year, it is advisable to do it more frequently because you catch the disease at an earlier stage and you treat it earlier. Okay, after we talk about the pap smear, I'm sure many people have lots of reservations. Is it painful? Don't worry, the pap smear is actually not painful. It might be slightly uncomfortable. If you're very sensitive, do let your doctor know. I'm sure your doctor will, make it a point to be gentle. Okay. Next, some people say, do I need to do it even though I feel totally well and have no symptoms? Shall I wait until I have some pain or symptoms? But like we said just now, early cervical cancer actually has no symptoms. So it is a screening test that should be done when we are healthy so that we can catch the disease at a very early stage. Some young women have had the HPV vaccination before. So you do ask, do I still need to do it if I have had HPV vaccination before? Well, the answer is HPV vaccination actually protects you from future HPV infection, but it doesn't cure any infection that you have had before, and also the vaccination is not 100%. So yes, even though you have had the vaccination before, you should still undergo the pap smear screening. Okay. Now, a bit about HPV vaccinations. So there is this Gardasil. So these are the 3 vaccinations that are available in the market. The oldest one is called Gardasil, and it was available, I think, about 15 to 20 years ago. It was the first one on the market. It consisted of 4 types, type 16, 11, types HPV type 16 and 11. These 2 types cause warts, and HPV types, HPV types 6 and 11 cause warts, and HPV types 16 and 18 cause cervical cancer. A few years down the road, Cervarix was launched, and this Cervarix covers type 16 and 18. So it was a vaccination which was specifically designed to prevent cervical cancer. And now this is the latest and the best, and it is the one that has been that is usually recommended by gynecologists and doctors around the world. And this is the Gardasil 9, which actually contains 9 subtypes of HPV subtypes. So it has the widest coverage. So it protects from both cervical cancer as well as cervical warts, okay, and genital warts. Yeah. So a note again, these vaccinations are designed to protect against future HPV infections, but they will not cure any pre-existing infections. Yeah. Okay. So next, what if my results are abnormal? If I have done the pap smear, what happens next if the results are abnormal? Well, if the results are abnormal, then you'll be referred to an ONG specialist by your GP. And most likely you might be required to undergo a test called a colposcopy. If you look at the picture over here, this is how a colposcopy is being done. We put the patient on the bed and the doctor sits in between your legs, and we actually look at the cervix with a high-powered magnification microscope. Okay, so actually what your doctor sees is this. This is a picture of what your cervix looks like. Okay, so it is the test to confirm what the pap smear picks up. Okay, because it is more accurate. So if you look at this picture, the normal cervix is actually smooth and pink, but whatever is abnormal is white and rough. So if we do pick up areas of abnormalities, we might need to biopsy them, take a small little piece of tissue to test and confirm our suspicion. Okay, so as I said just now, the whole point of doing the colposcopy is to pick up the disease when it is in this stage, CIN 1, 2, and 3 stage, so that we can fully treat you so that it doesn't progress into cancer. Okay, now I think I'm coming towards the end of my talk, and we have some take-home messages. Number one, prevention is better than cure. So do remember to do your regular pap smears. Pap smears should be done as long as you have ever been sexually active. Even if you have ever been sexually active 20 years ago, but you are no longer sexually active now, you should still do your pap smears. If you are between 25 to 25, and if you are between 25 and 29 years old, then you should be doing pap smears. Above 30, you can consider adding in the HPV testing. And if you have any doubts, speak to your friendly gynecologist. And I think that's all for my talk. And with that, I thank you.
Thank you for Dr. Tan and Dr. Freda for a very informative and insightful sharing this evening. For our friends here, we welcome any questions related to the topics that just have been shared by Dr. Tan and Dr. Freda. Silakan ya teman-teman, bisa ketik pertanyaan kalian di kolom Q&A. Nanti akan dijawab langsung oleh dokter. Nah, malam ini kita kedatangan dua tamu wanita dari Indonesia, dan kebetulan dua-duanya tinggal di Jakarta. Mereka adalah penyintas kanker serviks dan kanker payudara. Atau kita mungkin lebih familiar dengan istilah cancer survivor. Mereka akan sharing sedikit pengalaman mereka untuk teman-teman di sini. Semoga pengalaman mereka bisa menginspirasi dan menambah informasi dan pengetahuan untuk kita semua. Yang pertama akan saya panggil adalah Grace Anggreni. Grace Anggreni tinggal di Jakarta, adalah seorang guru Pilates yang mengajar Pilates untuk kelas private, duet, atau grup dengan Instagram Gracie Pilates. Grace ketemu saya di Singapura waktu Grace menjalani treatment kansernya dan tinggal di Singapura selama beberapa bulan. Sekarang, Grace sudah kembali ke Jakarta dan masih mengajar Pilates secara aktif. Silahkan, Grace.
Hai.
Hai, Grace. Halo.
Halo.
Grace,
Ya.
saya mau nanya nih ya, apakah Grace bisa share sedikit dengan kami semua di sini, gejala apa yang Grace alami yang membuat Grace itu cek ke dokter waktu itu?
Oke, kalau boleh share, jadi awalnya mulai akhir Desember 2018, saya ada gejala keputihan yang saya bilang abnormal. Saya sempat ke dokter, dikasih obat sama dokternya, tapi nggak kunjung sembuh. Tapi saya masih tetap minum obatnya ya. Terus 1-2 bulan setelah itu saya mengalami haid yang lebih banyak daripada biasanya. Kadang banyak, kadang normal. Saya pikir, oh ya mungkin kecapean kali ya. Terus saya sempat cek HB, karena rasanya lemas, jadi HB-nya cuma 7,6. Pendarahannya yang waktu banyak itu saya mengalami juga keluarnya sampai darahnya besar-besar gitu. Akhirnya saya Juni tahun lalu memutuskan untuk ke dokter, salah satu dokter di Thomson, Singapura. Waktu datang dokternya langsung suruh saya untuk biopsi, terus hasilnya CA cervix 1B. Gitu. Singkat cerita ya.
Ya. Sebelum terdeteksi ya, apakah Grace suka menjalani kayak health screening yang rutin gitu nggak?
Nggak pernah cek full health screening, paling ya cek kayak blood test aja biasa sama blood pressure. Nggak pernah, jadi kayak even HPV atau pap smear juga nggak juga. Jadi kayak saya memang miss di situ.
Oke. Kalau Grace bisa memberi saran untuk peserta di sini dalam 1-2 kalimat ya, apakah yang akan Grace bagikan?
Setelah saya ngalamin sendiri, jadi early check sama early detection itu I think is very important. Jadi kalau ada masalah yang seperti tadi dibilang, jadi better prevent daripada udah terlanjur kena gitu.
Iya, iya.
Jadi lebih bisa cepat terdeteksi ya.
Iya, iya, betul, betul.
Itu aja.
Ya. Makasih banyak Grace
Ya,
yang udah.
thank you.
Thank you.
Semoga bisa membantu yang lain.
Ya. Thank you ya Grace udah nyempetin diri hadir di sini dan berbagi dengan kita semua di sini. Wanita kedua yang akan share dengan kita adalah Ibu Adik Wibowo. Ibu Adik Wibowo adalah seorang lulusan dokter dan sekarang bekerja sebagai peneliti senior dan dosen senior di Universitas Indonesia Jakarta. Beliau pertama kali diperkenalkan dengan Dr. Tan Yaswam pada Januari 2020 dan selanjutnya memilih untuk dirawat oleh Dr. Tan beberapa hari sebelum COVID-19 menyerang Indonesia dan Singapura. Karena perbatasan imigrasi antara Singapura dan Indonesia, maka beliau melanjutkan pemeriksaan di Jakarta dengan seorang spesialis senior dan berniat untuk kembali ke Singapura secepatnya. Beliau menikah, memiliki 3 anak dan 2 cucu. Hingga saat ini, beliau sangat aktif, masih mengemudi sendiri, dan mengutamakan kesehatan. Saya bertemu Ibu Adik dan anaknya Mia di Singapura awal tahun 2020. Tapi waktu itu saya belum sempat bertanya sama Ibu waktu itu ya. Nah, Ibu Adik, mungkin Ibu Adik bisa cerita sedikit dengan kami semua di sini, bagaimana pengalaman Ibu dari pertama terdeteksi atau gejala awal yang Ibu alami. Silakan Ibu Adik.
Terima kasih organizer. So November 2019 saya iseng-iseng lihat di kaca ya. And then saya lihat breast kanan saya kok bentuknya nggak bagus, nggak bundar dan agak besar di satu sisi. Terus juga putingnya agak masuk ke dalam. Ini menimbulkan kecurigaan saya. Dan terus terang saja, selamanya saya jarang sekali cek breast, sebab merasa tidak ada history di keluarga dan tidak ada risk factors. Ya, saya lanjut saja, sehingga sesudah saya melihat ada kelainan di salah satu breast saya, Desember saya mamografi, saya lanjut USG Jakarta. Lalu memang terlihat bahwa ada lump atau benjolan 2,5 cm. Lalu saya berpikir, wah ini luar biasa serius nih. Jadi saya langsung menghubungi dokter saya di mana saya selalu check up untuk hal lain di Singapura dan minta referensi dokter untuk breast specialist di Singapura. Disitulah saya mulai berkenalan dengan Dr. Tan Yaswam. Januari saya ke Singapura, pertama kali saya bertemu dengan Dr. Tan Yaswam dan nasihatkan sesudah dilihat untuk lebih baik diangkat. Jadi selama Januari dan Februari saya lakukan semua pemeriksaan di Singapura dan minggu ketiga Februari saya operasi di Thomson Hospital, tinggal 2 minggu di sana post-op dan sempat ke onkologis yang direkomendasikan oleh Dr. Tan, tetapi saya harus pulang. Nah, waktu saya pulang, saya tidak bisa kembali lagi karena terserang COVID di Jakarta, bukan saya yang kena, sehingga saya terhalang untuk datang lagi ke Singapura. Saya tidak berhenti, saya lanjut memang seperti yang dikatakan tadi mencari check up di Jakarta sampai hari ini, tetap minum obat yang diberikan dan melakukan pemeriksaan secara rutin. Yang penting adalah saya selalu menjaga stamina tubuh, olahraga rutin, dan sangat menjaga makanan sesuai usia. Lessons learned yang saya pelajari, memang betul. Jangan pernah sepelekan periksa payudara. The earlier the better dan penanganannya juga pasti akan lebih mudah seperti tadi sudah diuraikan oleh ahlinya. Yang kedua, pengalaman saya adalah begitu ada sesuatu yang aneh, langsung periksakan diri, jangan pernah ditunda. Dan ketiga, kalau memang harus diangkat, siapkan fisik, daya tahan tubuh harus baik, siapkan juga mental, karena saya waktu itu juga sempat down, divonis mempunyai keganasan tersebut. Siapkan keluarga, yang penting, dan siapkan juga keuangan. Jujur, dana yang dibutuhkan memang cukup banyak. Yang paling penting buat saya adalah mencari dokter yang komunikatif, yaitu kalau buat saya adalah dokter yang tidak gaptek, yang bisa bersedia dan dihubungi via email atau WA kapan saja, cepat merespons kalau kita kirim email dan bertanya, willing to listen, willing to explain in detail. Dan untuk itu, karena tadi sudah disebutkan nama dokter saya, I would like to say thank you to Dr. Tan Yoasam. She has all the characteristics, dan dialah yang menjadi dokter saya. I'm so proud to be treated under her good hands and hope that after COVID-19 is over, I can come again to see her for checkup. Thank you very much. Terima kasih.
Ya, terima kasih. Terima kasih banyak Ibu Adi yang sudah menyempatkan waktunya di sela-sela kesibukan Ibu untuk sharing dengan kami. Sangat menarik Ibu, sangat informatif dan sangat membuka mata kami semua ya di sini. Kami juga terus mendoakan Grace dan Ibu Adik untuk treatmentnya dan untuk pemulihan yang total. Terima kasih. Sekarang tiba saatnya sesi question and answer atau tanya jawab. Saya akan bacakan satu-satu. Nanti akan saya sebutkan untuk Dr. Freda atau untuk Dr. Tan ya. Saya mulai dari yang pertama, pertanyaan dari Beatrice. So this one I think is about breast. So maybe Dr. Tan, for Dr. Tan. So she asked about what is palliative chemotherapy, and if the patient needs to do chemotherapy, will chemo medicine be hard on organs like heart, liver, and kidney? And would it be better to have medical oncology with internist background to lead the chemotherapy? Please, Dr. Tan.
Yes, thank you, Beatrice, for the question. So, as explained in my talk, the lab doctor will confirm what kind of breast cancer it is, ER, PR, and HER2. So depending on the combination, positive or negative, myself and the medical oncologist will discuss, is it better for the patient to get surgery first, followed by chemo, or chemo first and then surgery? So for chemotherapy, it is true. The side effects, the most common ones is hair loss. Most patients get a bit of a loss of appetite. Some have ulcers, some numbness. Maybe the most dangerous complication is a severe fever and sepsis. So I work with a few medical oncologists because for medical oncologists, their training is to treat all kinds of cancer. But medical advances are so fast, there's a few who are even more subspecialized for breast oncology. So I have my personal preferences. And another preference I have is to also ask the patient. Some people prefer a male doctor, some people prefer a female doctor. Some like the more caring, warm type. Some are like the very fierce, authoritative type. So chemotherapy is for some people, it's a very challenging 6 months to a year. So I think it's very important to match the correct doctor for the patient. Now, other than chemotherapy, for patients who are HER2 positive, they have targeted treatment. So that one is specific only for HER2 positive patients. For that one, the side effects is mostly heart condition. So before we start, you do need a heart check before we can proceed. I hope this answers your question. Oh, one last thing, a palliative. The term palliation refers to the care given to patients with advanced stage 4 cancers, where our treatment goal is not to cure anymore, but to make sure that the patient is comfortable and can enjoy the remaining quality of life very well. So whether it's palliative chemotherapy, palliative care, palliative support, or palliative surgery. So that's the term we apply.
Oke, semoga cukup jelas jawabannya. Saya nggak translate lagi karena Ibu Beatrice ini tinggal di Singapura. Jadi pasti sudah ngerti ya, karena pertanyaannya juga dalam bahasa Inggris. Jadi kalau kalian mau dijawab, mau ditranslate ke bahasa Indonesia, pertanyaannya dalam bahasa Indonesia ya. Oke, sekarang kita lanjut ke pertanyaan kedua dari Ailina. When is the best time to do pap smear? So this is maybe to Dr. Freda. How many days after period?
Hi, thank you for the question. Yeah, a very good question. So the reason why we don't want to do the pap smear during the period time is because sometimes the blood from the period can interfere with the results, thereby making the interpretation difficult. So it's best to do it when you are totally clear, and the best time is to do it in the middle of the month. So right in the middle of the month. So at least after the first 10 days of the period.
Jadi hari ke-10 gitulah mungkin ya, sesudah hari ke-10 untuk melakukan pap smear. Okay, the next question from Vinda Nugroho. How effective HPV vaccine to avoid cervical cancer? Is it more effective when taken in early age before a girl's first period? Silakan, please, Dr.
Terima kasih. Okay, so thanks for the question. Yes, you are right. It is more effective when it's taken earlier. The crucial thing is not about the first menses, but the crucial thing is about when the woman or the young lady first starts having sexual intercourse. So it's most important to take it before you get married or before you have your first sexual intercourse, because then you have not been exposed to the HPV virus at all. So then there is a better protection.
So it's not about the first mens, but about the first sexual intercourse, right?
Yes. Yes.
Okay. Jadi untuk teman-teman, kalau yang punya anak perempuan, begitu sebelum punya pacar, itu resiko tuh. Kalau udah punya boyfriend, nah takut kan, lebih baik divaksin dulu. Okay. The next question is from Ailina. If I have regular abdominal pain, how do I know it's not the symptom of cancer? Then the second one, if I am not married and not sexually active, do I need to take HPV vaccination?
Okay, so for the first question, if you have a regular abdominal pain, you are right, you wouldn't know whether you're having any form of cancer. If you are worried, you could see a doctor. You might want to do a scan. So there are many different kinds of cancers in the tummy. It could be gynecological cancers like cervical, ovarian, or endometrial cancer, or it could be other cancers like the colon, intestines, or even other things like liver or pancreas. So it's a bit difficult to answer this over the internet, but you probably want to see a doctor to check it out. Arvina, do you want to translate this first?
Sorry again. No, can you?
Do you want to translate this first, or I answer the second question?
Yeah, can you answer the second question first? Because this one, Ailina asked in English, so I assume.
Okay.
I assume.
Sorry, I can't remember the second question.
Oh, okay, the second question. Okay, if I am not married and not sexually active, do I need to take HPV vaccination? So kalau teman-teman, saya sampaikan gini. Jadi ada pertanyaan. Oh, sorry.
Yeah. So this one is up to you. Firstly, if you're not married and you're not sexually active, you don't have to do pap smears because the risk of you getting cervical cancer is very, very low. So in the same vein, I would say that by right, doing the HPV vaccination is not that crucial. But if you are, very, very scared, you want to be all covered, taking the vaccination there is no harm in taking it.
Okay. The next question from Veronica Gunawan. Is it true that certain foods trigger the growth of breast and cervical cancer? This one may be for both doctors.
Okay, maybe I start first. So at least in Singapore, a lot of our patients have the idea that chicken will trigger cancer. I don't think it's true. It is not true. It is not true. the misconception came about because some years ago, there's some report that a lot of chickens got growth hormone injection. So that kind of hormone is not really linked to breast cancer. For breast cancer, the main dangerous hormone is estrogen, which all of us women have. So that's why if a cancer is ER positive, our very own female hormones can trigger the cancer to keep growing. So patients need to be on tablet to force them to go into early menopause. So my advice to my patients is, if you've ever been diagnosed with a breast cancer, ER positive, the only thing I think to avoid is a soya bean, the yellow bean that's made to make a tofu, soya bean curd, or even a tempeh. So again, having a bit of the tofu once in a while is not harmful, but for some people who are vegetarian and using the soybeans as the only source of protein, I would advise them to consider switching to other source of protein, such as a chickpea or lentil. Yeah. Then I think Dr. Khoo, can you assist with the cervical part?
Okay, thank you, Dr. Tan. So for cervical cancer, no, there is no food that can trigger or increase the risk of cervical cancer. However, there is cervical cancer. If you talk about cancers in the female organs, there's some food that can increase the risk of you getting womb cancer, endometrial cancer. So that will include the food as high fat and high in sugar, thereby causing you to have higher chance of getting diabetes or high cholesterol or obesity. But that one is another talk for another time. Yeah. But for cervical cancer, no.
Oke. Semoga bisa diterima jawabannya. Dan saya lanjut ke pertanyaan berikutnya dari Hana Ratnawati to Dr. Freda Khoo. I am Hana from Bandung.
Hi,
Hana. If we already done the cervical cancer vaccination, how long or how many years the antibody will effective protect from cervical cancer? Should we repeat the vaccination? Thanks.
Thanks, Hannah, for the very important question. These vaccinations are designed to have lifelong protection, okay? Which means that after the initial vaccination, even though the antibody levels might drop down, however, at the next exposure to the virus, the antibodies should be reactivated. Having said that, if you were vaccinated with the earlier vaccinations, which are the ones with the double subtypes, the cervarix, or the ones with the 4 subtypes, it is also not wrong to consider taking and it's no harm to consider taking the one with the 9 subtypes, because there is more coverage. If that answers the question.
Okay. So I hope can answer untuk Ibu Hana. Untuk the next question would be from Stella. She asks about Gardasil 9 vaccination. Is it supposed to be done after the child reach 10 years old?
10 years old.
Yeah, the first menstruation is on May 2020. Is there any certain age? I think it's almost the same question as before, but maybe if you can explain again, I will transfer to her.
Yes, okay. So these vaccinations are licensed to be taken before 26 years old or before the first sexual intercourse, which means if it's given to a young woman, we presume that the antibody response is stronger. Okay. So then the protection later on in life is stronger. Now, how young is it? There is no best time as long as it's taken less than 26 years old. But there are some governments around the world who are giving it to school-going children, because I think that is the best time to catch them.
School-going children?
Yeah, like in 14 years old in secondary school, because that's the best time to give them give all the girls vaccination, and also nowadays teenagers are being exposed to sex much earlier, so it's safer to vaccinate them, I guess, maybe when they're younger, as teenagers.
Oke.
Yeah.
Oke. Jadi untuk Stella, dokter bilang patokannya itu di bawah 26 tahun. Nggak ada patokan semuda apa, tapi kebanyakan di Singapura, government biasanya menyarankan untuk anak-anak sekolah di usia 14-15 tahun. Karena sekarang keadaannya itu anak-anak lebih free gitu ya, lebih expose sama pergaulan seks bebas gitu. Jadi lebih baik, lebih aman umur segitulah. Oke. Next question from Shirley Wijaya. Is it necessary to do mammogram even though yearly ultrasound check every year already done? This is for Dr. Tan.
Yes, so I still would like to encourage women above 40 years old to go for mammogram, because remember, the ultrasound can only see lumps, and by the time there's a cancerous lump, it will be invasive cancer usually. The idea of the mammogram is to catch it as a calcium spots, which will be the stage 0 cancer, ductal in situ, or even earlier stage called atypia. So age-wise, start at 40. When women are younger, the breast tissue is too dense, too white. Everything is white, so the calcium cannot be seen. And when we start too early, if every year you get the radiation, the total amount can build up and trigger other problems. So worldwide, quite standard, good to start at 40. If let's say you are worried about the pain or the discomfort, then can start a bit later, 45 or even 50. But in Singapore, most of I invite my patient to start screening at 40 years old.
Ya, oke. Semoga cukup jelas jawabannya untuk Ibu Shirley. Oke, ada thank you for Dr. Tan from Beatrice. Clear, Dr. Tan, thank you very much. Okay, another questions from Feli. She had mastectomy with reconstruction from the back on March 2020. Triple negative stadium 2B. Already got chemo 6 times, radiation 25 times. Is there any other step that she can do? And what kind of tests? Thank you.
Wow. Wow, okay. For personal questions, all right, I am glad that you've completed your treatment successfully. That is very good. Always bring back your question to your own doctor as well, yeah, because they'll understand your case better. So if my approach for my patients is, I would like to evaluate the person's lifestyle as well, because the medical treatment that can be prescribed has already been done. The other things we can do is to modify our own lifestyle to reduce the risk. So some simple things, smoking people should stop smoking. If obese, try to lose extra body fat. Surprisingly, something that a lot of doctors don't talk about is the mental emotional wellness. If you think about it, when women are very stressed, or anybody is very stressed, we end up with more problems of migraine, heartburn, gastric problem. So stress linked to cancer is a very real thing. So now that you've been through all the surgery and chemotherapy, you are now in remission, all right, you are cured. In the future years, try all these lifestyle modifications to minimize your risk of recurrence. Number 2 is to have complete trust in your doctors and come back for the regular follow-up, so that in case if cancer comes back, we catch it early again and you can again be cured.
Semoga bisa menjawab pertanyaan dari Ibu Feli. Dokter menyarankan untuk Ibu Feli lebih kontak dengan dokternya lagi untuk mengetahui treatment seperti apa yang sebaiknya dilakukan. Oke, untuk yang berikutnya, the next question is from Ibu Adik Wibowo. Dr. Tan, greetings. Once your body system is accepting the Femara treatment, can we take it up to 5 years, or it must be changed to another medicine with similar effectivity as Femara? Thank you.
Thank you, Dr. Adik. So good to hear from you. Yeah, we miss her a lot at Thomson.
6 months already, Doctor.
Thank goodness for technology. We can still at least do some email. Yeah. So, Dr. Adik, for Femara, it is prescribed for postmenopause ladies, and it's more effective for the ER positive cancers. So I'm sure your doctor will have arranged the bone scan to check the bone density, because one of the side effects is to trigger osteoporosis, where the bone become very weak. So as long as you're taking your supplements, having the extra booster, and your bone mass is steady, it's all right to stay for 5 years. The switch, I'll leave it to the oncologist to decide. Some patients tolerate well, 5 years, up to 10 years is okay. If some patients develop some minor side effects, that's when they will do the switch to a different aromatase inhibitor. Okay?
Okay. Thank you. Semoga cukup jelas ya Ibu Adi. Okay, the next question is from Lina Wijaya for Dr. Fredaku. How long does the HPV vaccine last?
Hi, Lina. We have actually discussed this earlier. The HPV vaccine is actually designed to last a lifetime. Yeah.
Okay. So umur hidup, yeah. Okay. For the second one, the second question, sorry. For the next question is from Anita. She has 2 questions. The first one is, she has irregular menses, sometimes over 3 months. What should she do? She is a teenager and not sexually active. She went to gynae before. They give her Primolut tablet. Is it safe? Any other solution? Or maybe her diet have to change? Maybe the first questions first.
Okay. Hi, Anita. I'm presuming that your irregular menses over 3 months means that you're having continuous bleeding over 3 months. Sometimes this happens when you have gone through a few months without any menses. So let me explain again. For some people, if they have missed their menses for 2 to 3 months, the next cycle, it comes for a long time. So if that's what I'm understanding, the Primolut tablet is absolutely safe. It contains this hormone called progesterone. The Primolut is a brand name. So the actual medication is called norethistérone. It is very safe. There is no side effects, or there's very hardly any complications, and very safe for teenagers. Now, what you need to do, it really depends on what the cause is. We need to see, is it because of hormone imbalance, or is it because we need to wait a few years before your menstrual cycle matures and becomes more predictable. So this one, you really need to see your doctor in person. When you talk about diet, I would say that you only need to change your diet if you are overweight or obese. Okay, for some ladies, if they are overweight or obese, it can cause irregular menses. Either the menses don't come, or when it comes, it lasts for very long. So if that's the case for you, then you might want to cut down on the fat and the sugar intake. Yeah.
Okay. Semoga cukup jelas untuk Anita. The second questions from Anita is, her mom had ovary cancer. Is it true that HPV vaccine can prevent from getting it? And if she forgot that she already had vaccine or not, can she get the vaccine again?
Okay. I presume it is ovary cancer. So ovary is different from cervix. Yeah. What do you call ovary in Bahasa Indonesia, Avina?
Ovarium is rahim, I think.
No,
Oh.
telur.
Oh, indung telur.
Yeah.
Yeah, indung telur.
So ovarian cancer is not preventable by HPV vaccine. The HPV vaccine prevents cancer of the cervix, which is pintu rahim.
Yes.
Yeah, so it's different. So
so there's no vaccine for the ovarian cancer, right?
There is no vaccine for ovarian cancer. Yeah. So if you forgot whether you had the HPV vaccine or not, I don't know how old you are, but if you got the vaccine more than 5 years ago, it's likely not the latest one. Likely not Gardasil 9.
Yes.
So it was likely the first two.
Yes.
First two vaccinations.
Gardasil or Cefarix, right?
Yes. So yes, you can get the latest one again.
So if get the latest one, should she repeat the for the 3 course?
Yes. Yes.
Oh.
Yes.
So it's okay, not dangerous to repeat again and again.
Okay. Yeah.
Okay.
It's just like you know, I take a flu vaccine this year, and the next year I take it again.
Oh, okay.
Or hepatitis B.
Oh, yes.
Some people we take it when we are babies.
Yes.
But as we grow older, sometimes we have no antibodies. We take it again. So it's no harm.
Oke, jadi untuk teman-teman juga mungkin ada yang lupa atau dulu mungkin pernah ambil HPV vaksin, tapi yang terdahulu, versi yang terdahulu, yang pertama itu Gardasil, yang kedua Cervarix. Ini yang Gardasil 9 tuh paling komplit gitu. Jadi kalau mau diulang nggak apa-apa. Tapi harus ambil full course dari pertama, kedua, ketiga ya, jabnya. Oke. For the next question, this is thank you for Dr. Fredaku from Hana Ratnawati.
My pleasure.
From Felio to Dr. Tan, thank you very much. From Adik Wibowo to Dr. Tan, thank you. Doctor, thank you very much. And this is another question from Veronica Gunawan to Dr. Tan. Is it normal for a 7-year-old girl to start having breast knobs? My little girl already has breast knobs.
Yeah, this starting from my work in KK Hospital, it's a KK Women and Children Hospital. In the past 7-8 years, we noticed a lot of younger girls are having early puberty. So as young as 6 years old, the mother may notice a lump growing below the nipple. So by texture, it feels almost hard because most of the girls are very thin. So that is the normal gland tissue. So overall, if you're a bit worried, no harm to bring to see a doctor. I think easier to find a lady doctor, a bit more motherly to reassure the young girl. Examination with your permission, and then ultrasound to confirm it is just the gland tissue. When I see them, of course, we just check. I reassure the girl in the next few months, next 1-2 years, the other side may start to grow out as well. At the same time, we ask some questions. What's the diet like? Could the family be eating a lot of extra processed food? This is not just in Asia. In a lot of the world, different doctors, pediatricians are reporting the children are developing faster at the earlier age. So we don't really know why. We suspect it is in all the different chemicals that we're eating now. So overall, no harm. But if you find that your child has started puberty very early, for the girls or for the boys, might be worthwhile to talk to a pediatrician to check if there's any extra hormone secretion.
Okay. Hope it's clear enough to Veronica. Okay, for the next question from Ailina, does menopause connected to any cause of women cancer?
No. Menopause does not cause higher risk of any women cancer. So now the question is, what do we look out for when menopause happens? 2 things. One is the heart. Okay, after women get menopause, they have higher risk of heart disease. Okay, and number 2, osteoporosis. the higher risk of the bones becoming thin.
Okay, thank you. Hope it's clear enough. Okay, for the next question from Feli, she already got vaccine, HPV vaccine with Gardasil in 2017 when she was 44. Does she need another vaccination of Gardasil 9? Thank you.
This question is quite personal to you. I would say if you had vaccinated yourself in 2017, that was 3 years ago, and the Gardasil was a 4-valent vaccination, I would say you don't really need to repeat the Gardasil 9 vaccination unless your risk is very high. Yeah, but
Like very active sexually, maybe?
Yeah.
Like that.
I mean, for some people, if they have many different sexual partners, then you might want to protect yourself. But if you have one stable partner, you're in a stable relationship, then chances are you don't have to.
Ya,
Yeah.
jadi mungkin saya perlu transfer ke bahasa Indonesia. Jadi untuk ini agak lebih sedikit personal. Jadi kalau partnernya satu steady, nggak perlu ya, menurut dokter tidak perlu lagi. Tapi kalau partnernya mungkin banyak atau berganti atau gimana gitu, itu mungkin perlu suntik vaksin Gardasil 9. Okay. Thank you from Anita. Thank you for the explanation, Dr. Frida. God bless. Okay, and this is maybe the last question for both doctors. For prevention, what are your opinions about additional supplement for women's health, like TCM, like Pai Fong Wan or Royal Jelly, which is said that can have positive effect on make it the menstruation like better, regular, and without syndrome to stomach and breast. Thank you. Hope it's clear.
Frida, you first or?
Up to you. You want to go first?
Yeah, okay. So, of course, I think as Western trained doctors, we are not so familiar with the effects of traditional Chinese medicine. So, in my practice, I do have a few TCM doctors that I work with, but our advice are quite consistent. We don't mix the treatment. So, whether it is a breast pain, a kind of breast infection, or breast cancer, we do it as a complementary treatment. So, under my part, we do the surgery, we arrange for the chemo. After 1 year of remission, then we refer them to the TCM to boost up the energy after that. So myself being Chinese, I believe in TCM, but I think it works in a slower and more holistic way. So my advice would be, if you have the good recommendation for TCM doctors and medicine, by all means go ahead, but don't forget our Western practice of early screening and treatment.
Ya, jadi kalau menurut Dr. Tan sebagai, maybe can ask Dr. Frida first to maybe have additional answer.
Okay, for me, about the gynecological cancers, I would say no, there is no TCM medicine that can prevent gynecological cancers. But if you are thinking and you're asking what are the steps that you can take to prevent gynecological cancers, it would be to protect yourself from any sexually transmitted diseases by using a condom, making sure you have a stable partner. Other things would be like a prolonged period of breastfeeding is good to protect from ovarian cancer. Other things would be to keep yourself healthy generally, so prevent obesity, diabetes. All this will help to prevent endometrial cancer.
Okay, semoga saya ingat. I try to translate. Kalau dari Dr. Tan, yang saya tangkap itu Dr. Tan sebagai dokter dengan pendidikan Western tidak mendalami soal TCM. Jadi ya dokter nggak bisa advice apakah itu efektif atau enggak. Kalau Dr. Frida bilang bahwa tidak ada obat TCM yang bisa memprotek atau mencegah dari kanker yang berhubungan dengan kewanitaan. Yang paling penting itu mungkin yang pertama, kalau melakukan sexual intercourse, hubungan seks, pakai kondom. Terus, apa lagi ya dok? The second one after the condom thing?
Having a stable relationship.
Ya, jadi hubungannya yang stabil. Satu aja, jangan ganti-ganti, jangan banyak-banyak. Okay. The third one?
To prevent ovarian cancer, a prolonged period of breastfeeding. Breastfeed as long as you can.
Ya, jadi waktu masa menyusui selama mungkin, lebih bagus. Okay. And the fourth one, I think healthy lifestyle, is it?
Yeah.
Ya, jadi yang keempat adalah ya berusaha menjalani lifestyle yang healthy lah, yang sehat. Jadi moderate semuanya, makan, olahraga teratur, berjemur mungkin ya, vitamin D, right, dokter? Okay, yeah. I think, okay, last question from Feli. Say thank you very much to Dr. Freda. And the last question, what is the recommended screening for women to go for? Pap smear, mammogram, breast ultrasound, or any others like abdominal ultrasound?
Wow. So I think for screening programs, depending on your age, risk factors, and I think resources, there are many types of packages available. Good to have, I think within Thomson, we do have a family practice that can do the initial assessment. So even something very basic like the height and weight is really a good indicator to check for your risk for cardiac disease. Then from there, some basic blood tests to screen for any heart, so liver or kidney problems, urine tests, these are the most basic. Then specific for woman cancer, I would say cervical cancer, pap smear screening, mammogram. Colon cancer in our region is also one of the top 3 cancers. So the best screening is the colonoscopy. And I would like to take the chance to also share that Thomson has a Thomson Surgical Center with a team of general surgeons, both men and lady doctors who can assist. What else is there? Other cancers, unfortunately, are harder to screen for. Like Dr. Frida said earlier, for lung cancer, brain cancer, they are rare, they are internal, it's harder to screen for. So most important is not to smoke, moderate drinking alcohol if you drink. Yeah. Frida, anything extra to add?
No, I think you answered it very well. Thank you.
Oke, semoga itu menjawab pertanyaan yang terakhir. Kayaknya kita harus ini ya, saya harus tutup dulu acara ini, sesi question and answer. Terima kasih untuk teman-teman yang sudah bertanya. Semoga semua jawaban cukup jelas. Bila ada yang masih ingin bertanya lebih lanjut, bisa email ke hello@friendlingsingapore.com atau bisa kontak saya by WhatsApp. Nanti kami akan bantu untuk tanyakan lebih lanjut ke Dr. Tan atau Dr. Frida. Karena di sini time waktunya agak terbatas, jadi mohon maaf kami nggak bisa menjawab semua dan saya nggak bisa translate semua ke bahasa Indonesia. Oke. Sekarang waktunya door prize. Kita lihat lagi door prize